وانتشت روحي وصار الدمع يجري يا إلهي خذ بقلبي للرشاد أشرقت نفسي بنور من فؤادي حينما رددت يا رب العالمين.
Blindness and vision impairment in South Africa, a country of almost 50 million, has a detrimental impact on the individual and extended family, often worsening already dire socio-economic conditions. The World Health Organization estimates that nearly 80% of blindness is preventable or treatable with medical and surgical interventions. Cataract is a painless clouding of the lens of the eye. It develops over a long period of time, gradually worsening the eyesight and eventually leading to total blindness. The disease is most prevalent amongst the elderly. An estimated 400,000 South Africans are already blind, with approximately 240,000 of these blind from cataracts. This translates into the following. Cataracts are responsible for more than 50% of blind cases amongst South Africans. Amazingly though, a person's sight can be completely restored with a highly specialized yet fairly simple medical procedure, and this in less than 24 hours.
This is a condition which is totally reversible. So we do the operation and remove this cataract and put an artificial lens in the eye, and patients see perfectly all right. And this procedure is done into operation theatre, takes about 30 minutes, and after the operation, the very next day, patient can see very well.
In some healthcare facilities, the waiting list for cataract surgery extends to well over a year. Dr. Shabir Hussain decided that the only way to cut down on the backlog of cataract operations was to start a cataract camp on a Sunday.
One of the meeting of Executive Council of Islamic Medical Association at Umtata Transkei a few years ago, the idea came that we can start a cataract program in this country. In Siboking Hospital, we started this program in 2005. First camp was in April 2005. And then other organizations also helped, like Pakistani Community of South Africa, Awqaf, and they fund us for big programs as well. So we started doing this one. We buy intraocular lenses, payment for the nurses and the staff, which work over the weekend. So idea is to work over the weekend and just help our cataract patient to see again.
Although only 40 operations were planned over the weekend, the team managed to restore sight to 51 people, a resounding success.
For these 2 days of the cataract camp, we have done about 51 cases, which under normal camps we could have achieved. So we really thank to their efforts.
Thank you.
As the bandages were removed, shouts of jubilation echoed through the clinic's corridors. Many were seeing for the first time in years. Over 600 more people have regained their sight through this program, and the initiative has now received due recognition. It takes a little initiative, some dedication and sacrifice, and 500 Rand for lenses to change not only the life of one person, but also all those around them.
Ya Habib Allah, Ya Rasul Allah, Ya Habib Allah, Ya Rasul Allah, Ya Habib Allah.
Assalamu alaikum wa rahmatullahi wa barakatuh. I think what is important is that as Awqaf South Africa, we are a community endowment fund, a Waqf, and we support many different types of programs, being healthcare, education, and into many other fields. When this opportunity arose, when the Bosmont Muslim community approached us to support this project, we said, okay, well, this is something that we could support in terms of healthcare. And then we approached the Islamic Medical Association, and I think that's how it actually got here. So inshallah, this is something that is an ongoing project. This will be the beginning of many other programs such as this. I think it's important that as a community we look after our elderly and we look after the sick in the community, and this is an opportunity to actually provide them with a service that is not necessarily easily available, and hopefully that all the people that have been here thus far today have found it very satisfactory. Alhamdulillah.
I'm Taira Hassam. I'm a gynecologist by profession, and I'm here at the screening for IMA and Awqaf. I usually like to volunteer for IMA and Awqaf because most of our patients and most of our community are not very privileged to be able to afford to see a specialist as well as a basic general practitioner. So that's why we volunteer at these events, so that we can educate them and try and give them basic advice.
Basically what we're doing is trying to create awareness, health awareness, although I'm a big oak, but health awareness for the communities, and trying to give back to the community and allow people the opportunity to do such tests with no cost, and at the same time giving back to the community, whereas our lifestyles are so busy trying to make money and chasing the worldly matters, whereas not many people give back to communities.
We try and do this community projects specifically to make sure that everyone who cannot afford proper health care or cannot afford to get to clinics to check their blood pressure and their glucose, as well as their glucose, to make sure that they're healthy on a daily basis, we can at least provide these services to them.
Because we're helping underprivileged people who don't actually have full access to healthcare services and who might not necessarily have basically the ability to go to places like these.
Well, the reason that I chose to volunteer is just to give some of my time back to doing some voluntary work for the community, and just to help out at the IMA Awqaf Medical Center at the faith. So they require assistance, so they're always in need of doctors. So it's just fair on us that we assist the IMA in the initiatives to do screening for diseases. So Mr. Dean is a diabetic patient, and he's uncontrolled diabetes at the moment, and we're doing eye screening for diabetes and cataracts and primary eye problems. It's important that patients with diabetes get screened and eyes checked on a yearly basis to see if there's any changes at the back of the eye, so that we can prevent these complications, mainly blindness.
Assalamu alaikum. My name is Uncle Sadruddin Dean. I am here at Bosmont at the pre-Ramadan fete, and it's wonderful to be a part of this community and to take part in this service which is free for the elderly of our community. And I want to congratulate the organizers for the wonderful service that they performed, and the doctors and nurses that are giving of their time to check your sugar, your blood pressure, your eyes. Shukran very much, and a wonderful Ramadan to all.